Hello, I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hi, my name's Janet. I'm a registered nurse for AmeriStaff Home Health Services, and today I'm going to demonstrate how to use a glucometer. There's different types of glucometer. One you can use is the One Tut Ultra. This one is called the True Tut Test Results. It's really not about the glucometer as much as it is about the test strips. These little test strips that you're going to use to test your blood are the key to unlocking the correct results. You have to use the correct test strips with the correct glucometer. So today we're going to go through the process of how you would check your blood sugar. You want to get all your equipment out and ready to be used. The first thing we're going to get out is the Lancet device, and that's this. This is what we're going to use to poke our finger. The other thing we're going to use is the Lancet itself, the test strips, and the glucometer. You also want to use an alcohol wipe. So the first thing you want to do when you're getting ready to test your blood sugar is you want to wash your hands to make sure your hands are clean and free of any sugars or debris on your tips of your fingers. Once you do that, you can take an alcohol wipe and wipe the outside of your finger. Make sure it's extra clean. You're going to use the Lancet device. This pulls open like this, and as you can see, the Lancet goes inside the device. It fits into the Lancet device like that. Then you have to remove this little tab on the top so you can get the needle out so it can poke your finger. So if you twist this slowly, it will break off and it will produce the needle itself. You can just set that aside. Then you want to use the cover to cover over top of the needle. And it fits on just like that. There's numbers on the side of here, and this tells how deep it's going to puncture into your finger. First, when you're first doing it, you can start at the lower sensitivity rating, and then you might have to go up as your fingers get a little more calloused in order to obtain the blood. So the next thing is you clean the side of your finger off with alcohol. You always want to use the side of your finger when you're trying to get that blood instead of the tips of your finger. It's less painful that way. You have less nerve endings in the side of your fingers, so that's a helpful tip. So you want to draw back and get ready to what we call cock the Lancet device, and then you push this button in to prick your finger. So you're going to pull back to cock it and get it ready, let go, and then you push this button to prick your finger. Okay, so you get that device all ready. You want to get your test strips out of your machine. The test strips look like this. There's a little like key code on the end. That's the part that's going to go into the machine. And then there's a little slot on the top here, and that's where the blood's going to go. So you get your monitor, you put the key code part into the monitor, and that activates the monitor. Once you see that little droplet of blood on the monitor, it means it's okay to put the blood onto the test strip. So you cock your lancet, oops, and you push it against your finger, get ready to push it against your finger like so. You'll get your drop of blood. You'll apply the drop of blood to the test strip. Then you'll hear the machine count down once it has enough blood, and then you'll see your results on the machine. There's another way to test. Instead of using your fingertip, you can use the clear cap that comes with the device. You take off this gray cap, and you can use the clear cap. It just slides on just like the gray cap does. But then we're going to test our forearm. So like your fingertip, you're going to clean the area that you're going to test to make sure that there's no bacteria or sweat or anything on the area that's going to be tested. So you use an alcohol wipe, clean that area. You want to pull back and cock the lancet device. You want to hold the lancet against your forearm, just like you did your finger. You have to push down and apply pressure a little bit more so than with your fingertip on this when you're testing your forearm. Hit the gray button. Wait for the blood to come up. Take your tester strip and apply that sample right onto the glucometer. It counts down. And then you get your result. Once you get your result, you want to make sure that it's in that normal range. If not, then you're going to follow the steps that your doctor has spoken to you about. You want to dispose of properly both the test strip, because it has a little blood on it, can go into your sharps container, okay, to make sure that no one gets exposed to it. The other thing you want to do, oops, and then the needle itself, you want to remove this from your lancet device and put it in a sharps container. If you don't have a sharps container like this at home, you can also use a empty laundry detergent bottle, like a Tide or Downy, where it has the harder plastic sides, and then put the cap back on it. Or you can use a coffee can. You just want to make sure that the needle is secured so no one gets poked on it when you throw it in your garbage. You don't want the garbage man getting poked with it. The other thing that you want to do is very important when you're testing your blood sugar is once a month you want to use your control solution that comes with your package. This is to make sure that your glucometer is working accurately and you're getting the proper results. In order to use the control, you do the same actions. You put your test strip in the glucometer where it says to apply the blood. You're going to open your control, and it looks like blood. It's a little red fluid, and you want to make sure that that red fluid just goes up into your tester, and it will give you results similar to your blood sugar. This one says 47. So you look on your control, the range that comes with your control, and make sure that that's an adequate range for your meter. If it is, then that means that your meter's calibrated and working properly. If it's not, then you have to, maybe your test strips are old and they need to be thrown out, or maybe your glucometer needs to have the battery changed. Always have spare batteries available. That's one of the typical things that you want to look for. Make sure that batteries are fresh, have a spare backup battery. Testing your blood sugar is very important for preventing complications with diabetes. So that's why it's very significant that you check your blood sugars as often as your doctor recommends. If it's once a day, twice a day, 5 times a day, to keep your blood sugar in that normal range to prevent complications from diabetes. If you have any questions or concerns, please don't hesitate to call your doctor or call AmeriStaff at 248-288-2270. Thank you.